As a brain doctor who has spent decades treating older patients, I need to warn you about something that very few people talk about. Every day, millions of seniors reach for painkillers thinking they are harmless, safe, and even protective. A pill for a headache, another for arthritis pain, or a tablet to ease stiff joints after gardening. These small choices feel routine, ordinary, even responsible. But what if I told you that some of the most common painkillers, the very ones sitting in your medicine cabinet right now, could be quietly raising your risk of a devastating stroke? I have seen it too often in my practice. Patients come in confused about sudden weakness on one side of the body, slurred speech, or vision changes. They never smoked. They ate reasonably well, and they exercised when they could. Yet when I ask about their daily habits, one detail stands out again and again. They had been taking certain painkillers regularly, sometimes for years, without realizing the hidden danger. The truth is that medications like ibuprofen, aspirin when misused, and even prescription opioids can disrupt blood flow, damage fragile blood vessels, and set the stage for a stroke. These risks do not appear on the first day, but they accumulate silently, week by week, month by month, until one day the brain is pushed past its limit. In this video, I will reveal the 3 categories of painkillers that seniors must be extremely cautious with, explain how they affect your brain and circulation, and share safer alternatives that protect your health instead of putting it at risk. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, please type 0 to let me know how I can make better content for you. Part 1. Over-the-counter NSAIDs like ibuprofen. For decades, non-steroidal anti-inflammatory drugs, or NSAIDs, have been a go-to solution for pain relief. Medications like ibuprofen and naproxen line the shelves of every pharmacy, promising quick relief from headaches, arthritis, or back pain. Seniors often see them as safe because they are sold without a prescription. But behind this sense of safety lies a set of risks that are particularly dangerous for older adults. NSAIDs work by blocking enzymes called cyclooxygenases, which are responsible for producing substances that cause pain and inflammation. While this reduces pain, it also interferes with prostaglandins that protect the stomach lining and help regulate blood flow. Over time, this disruption can increase blood pressure, harden arteries, and weaken blood vessels. For seniors already dealing with age-related stiffening of the arteries, this added stress is like throwing fuel on a fire. One of the most alarming effects of long-term NSAID use is its link to hypertension. Studies published in the Journal of Hypertension show that regular use of ibuprofen raises systolic blood pressure significantly, especially in patients over 65. High blood pressure is the single strongest risk factor for both ischemic and hemorrhagic stroke. When seniors take ibuprofen daily for arthritis, pain, or chronic headaches, they may unknowingly be raising their stroke risk with every dose. Beyond blood pressure, NSAIDs also increase the risk of clot formation. By altering platelet activity and damaging the delicate endothelial lining of blood vessels, NSAIDs create an environment where clots are more likely to form and lodge in the arteries supplying the brain. I recall a 70-year-old patient who used ibuprofen almost daily for chronic back pain. She believed it was safer than prescription medications, but after months of use, Her blood pressure crept higher and higher until one morning she experienced sudden facial drooping and slurred speech. She had suffered a small but significant ischemic stroke. The connection was clear. Her regular NSAID use had quietly pushed her blood vessels beyond their limit. Some seniors also experience kidney damage from NSAIDs, further compounding the risk of stroke. The kidneys regulate fluid balance and blood pressure, and when damaged, they cause hypertension to rise even higher. The truth is, NSAIDs are not harmless. They are effective. Yes. But for older adults, they can be a silent heartbreaker and brain attacker. If this surprised you, wait until you hear about aspirin, a drug often called a lifesaver, but one that can turn deadly when used incorrectly. Part 2. Aspirin misuse. Aspirin has long been praised as a wonder drug, known for its ability to thin the blood and reduce the risk of heart attacks and certain strokes. For years, doctors recommended a daily low dose of aspirin for older adults as a preventive measure. Many seniors, wanting to protect themselves, began taking aspirin on their own without medical guidance. Some even increased the dose, believing that more must be better. But as research has advanced, we have discovered a darker side to aspirin misuse. The very mechanism that makes aspirin helpful, its ability to thin the blood by preventing platelets from clumping, can also become dangerous. In seniors, whose blood vessels are already fragile, thinning the blood too much increases the risk of bleeding in the brain. This type of hemorrhagic stroke can occur suddenly and with devastating consequences. I remember one patient, a 72-year-old woman, who took aspirin daily for years without her doctor's recommendation. She believed it would keep her safe from heart problems. One morning she developed the worst headache of her life, followed by sudden weakness on her left side. Imaging revealed a hemorrhagic stroke caused by a burst vessel in her brain. Her aspirin use had tipped the balance from protection to peril. Studies in journals like The Lancet have confirmed this risk, showing that in adults over 70, the dangers of brain bleeds may outweigh the benefits of daily aspirin unless specifically prescribed for conditions like atrial fibrillation or prior stroke. Another problem is that many seniors combine aspirin with other medications such as blood thinners or NSAIDs, dramatically increasing the risk of bleeding. Some even take it with alcohol, adding yet another layer of danger. The lesson here is simple but vital. Aspirin is not a vitamin. It is a powerful medication that must only be taken under medical supervision. Misusing it, even with the best intentions, can open the door to strokes far more deadly than the ones it was meant to prevent. And if aspirin misuse is dangerous, imagine the risks of stronger prescription painkillers, which can affect not just your blood but your brain and breathing as well. Part 3. Prescription opioids and hidden stroke risks. Opioids like oxycodone, hydrocodone, and morphine are sometimes prescribed to seniors dealing with severe pain, whether from surgery, cancer, or chronic conditions. These medications are extremely potent and provide powerful relief, but they come with risks that extend far beyond addiction or drowsiness. For elderly patients, opioids can quietly increase the likelihood of stroke in several ways. First, opioids depress the central nervous system. They slow breathing, lower heart rate, and drop blood pressure. While this might sound like it would ease strain on the body, in reality, sudden drops in blood pressure reduce blood flow to the brain. In fragile elderly patients, even brief episodes of low blood flow can trigger ischemic strokes. Furthermore, opioids disrupt heart rhythm. They can cause irregular beats, also known as arrhythmias, which increase the chance of blood clots forming in the heart and traveling to the brain. For seniors already struggling with atrial fibrillation, this combination is particularly dangerous. Another hidden danger is respiratory depression. When breathing slows too much, oxygen levels in the blood plummet. The brain, starved of oxygen, becomes highly vulnerable to injury. Even short periods of hypoxia can set the stage for stroke-like damage or worsen recovery if a stroke occurs. I treated an elderly man who had been prescribed opioids after hip surgery. Weeks later, he was found at home, confused, weak on one side, and gasping for breath. His oxygen levels had dropped dangerously low, and scans revealed he had suffered a stroke, likely triggered by the combined effects of low oxygen and arrhythmia from opioid use. Beyond physiology, opioids also increase fall risk by causing dizziness and impaired balance. Falls are one of the leading causes of head trauma in seniors, and head trauma often leads to hemorrhagic stroke. This creates a deadly cycle where the very medication meant to relieve suffering ends up opening the door to catastrophic outcomes. Opioids should only ever be used for short periods, under strict supervision, and only when absolutely necessary. For chronic pain, safer alternatives exist, and that is what we will explore next. Part 4. Safer alternatives for seniors. The good news is that protecting yourself from stroke risk does not mean living in pain. There are safer ways for seniors to manage discomfort without jeopardizing brain health. One of the simplest alternatives is acetaminophen, also known as paracetamol. When taken within safe dosage limits, it relieves pain without affecting blood pressure or clotting the way NSAIDs and aspirin do. For chronic joint pain or arthritis, non-drug approaches can be equally powerful. Physical therapy helps restore movement, strengthen muscles, and reduce stiffness. Gentle exercises like swimming, tai chi, or walking improve circulation, reduce inflammation, and provide lasting relief. Heat and cold therapy, when applied appropriately, can ease sore muscles and joints without any side effects. Diet also plays a role. Anti-inflammatory foods such as fatty fish, berries, leafy greens, and turmeric can reduce chronic pain while simultaneously lowering stroke risk. For those with severe pain, targeted treatments like steroid injections or nerve blocks may be recommended by doctors as a safer alternative to daily opioid or NSAID use. Emotional health matters as well. Chronic pain is often worsened by stress, anxiety, and poor sleep. Relaxation techniques such as deep breathing, meditation, or gentle yoga can provide relief not only for the body but for the mind. Seniors who engage in these practices often find their need for medication decreases significantly. The key is balance and intention. Pain management should never come at the cost of brain health. Working with a trusted doctor to create a personalized plan using the lowest effective dose of medication only when necessary, and combining it with non-drug strategies is the best way to stay strong, mobile, and independent without raising stroke risk. Doctor's final words. If there is one message I want every senior and caregiver to take away, it is this: painkillers are not harmless. Ibuprofen, aspirin when misused, and prescription opioids may offer quick relief, but they also carry hidden risks that can quietly raise your chance of a devastating stroke. Your brain, your heart, and your circulation deserve protection, not harm disguised as help. The solution is not to live in fear or avoid treatment altogether. It is to use medications wisely, under medical supervision, and to embrace safer alternatives whenever possible. Your body still remembers how to heal. With the right choices, you can relieve pain, protect your brain, and preserve your independence. Share this knowledge with someone you love, because awareness can save lives. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned today that you plan to apply in your own life. Let us support each other on this journey toward better health. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe so we can continue building a healthier future together.